Now, in the early 90s, after the 1985, when everything was criminalized by the DEA and and FDA was still blocking research, and there was all this rise of neurotoxicity, the whole idea that one dose of MDMA causes severe brain damage with major functional consequences, such that MDMA should never, ever be researched because we already know it's too dangerous. There was that whole rhetoric funded by the National Institute on Drug Abuse and vastly exaggerated science. Um, so in order to get over this idea of neurotoxicity mattering, the first study that MAPS proposed from 86 to 90, we worked on 5 different protocols for MDMA, all rejected by the FDA. Then what happened is that in 1990, a new group of people took over at the FDA to regulate psychedelics. And the first thing they did is they gave approval to Rick Strassman for a study of DMT. But it was the idea that DMT is the only endogenous psychedelic in your brain and that too much of it could cause schizophrenia. So the idea was, does DMT link to schizophrenia? So it was kind of a negative thing. It wasn't a therapeutic study. Right. So then MAPS worked with Dr. Charlie Grobe, and we proposed MDMA for cancer patients with anxiety because we felt that cancer patients with anxiety near the end of their lives, that there would be no consequences from MDMA neurotoxicity. And so the FDA called a special advisory committee meeting and had a 2-day meeting of the NIDA funded animal researchers to decide whether they should resume opening up human research after decades of virtually total suppression. And so the FDA said, yes, they should go ahead and open up the human research. And so they said to us, we're not going to give you permission to work with cancer patients because we're going to treat you like any other pharmaceutical company. All the information that's come from the underground counts for nothing. It only is what we see under direct FDA-approved studies. So we do a phase 1 dose-response safety study. So we did that during the 90s, during which the rave movement built up, the ecstasy, spread around the world, and the neurotoxicity. People were going crazy about how terribly damaging MDMA was. Sort of culminated in 2001 with Oprah showing fake brain scans, claiming that MDMA caused holes in the brain, which was graphically manipulated brain scans. But but near the end of the 90s, Charlie, we got the phase 1 safety study done, and Charlie was thinking he wanted to go work with psilocybin and end of life. He thought it'd be easier because of all the stigma about ecstasy and neurotoxicity and raves and parties. He said people don't even know what psilocybin is.
What exactly is neurotoxicity? Is it neurons dying or?
Well, they tried to make it seem that it was neurons dying, cell death, but it was actually in certain high doses, you can get nerve terminal degeneration of the serotonin nerve terminals. Mm-hmm. So that's what they claimed then was neurotoxicity. It doesn't appear at the doses that we use in humans, and it's not even clear that it's a negative thing. Now, one of the main...
You have to not hit the table.
It's too much. Okay. One of the main transformations in terminology has been from neurotoxicity to neuroplasticity. Mm-hmm. But it's basically talking to the same thing.
Yeah.
You reroute the way you process information.
But is that rigorously true? Like this serotonin, like having like changes in the serotonin system, is that really the same as neuroplasticity, or you just mean that like neuroplasticity was ignored and they were focusing on this negative kind of edge case?
I don't even think they really knew about neuroplasticity.
Right.
Yeah. No, they were just saying that we do this and there are certain terminals in certain pathways that are reduced. Damaged. Yeah. So it wasn't really cell death. But then we do know that people reroute the way certain memories happen, and that there's different... well, we've done fMRI studies, and others people have done fMRI studies to show that there's, after successful therapy, which doesn't mean just doing the drug, but after successful therapy for PTSD, people have less activity in the amygdala. Whereas if you have PTSD, you have increased activity in the amygdala where you process fear. You have reduced activity in the prefrontal cortex, so you're not thinking as logically. So triggers um, sounds that remind somebody of an explosion, or clothes similar to what somebody was attacked by somebody wearing similar clothes. You get triggered easily. You don't have the logical capacity. And then hippocampus, where we put memories into long-term storage, has lower activity. So this is what happens with PTSD. MDMA does the opposite. It reduces activity in the amygdala, increases activity in the prefrontal cortex, increases activity in the hippocampus and connectivity with the amygdala, and has hormonal release, including oxytocin, which is the hormone of love and connection and nursing mothers, that gives people a sense of safety, connection, self compassion. Bessel van der Kolk, who wrote the book The Body Keeps the Score, which I'll just say amazingly, he wrote it in 2014. And last week, it was the number one best-selling book on the New York Times list between ebooks and paperback
Mhm.
books. It was the number one in America. It's been on the list for like 260 weeks or something like that. So I think people in general are very much sensitized now to the role of trauma. And Bessel worked as our principal investigator on our phase 3 site and added measures of self-compassion, alexithymia, whether you can feel emotions or not, different things. And he's just published a really important paper in PLOS ONE about how MDMA works in the hardest cases. But where I'm trying to say this is that there are these changes in the way that neural activity is recorded, and that presumably means that there are certain sort of connections that wither away and others that are strengthened. And whether, I don't know that they're completely only the serotonin system ones, but there is definite brain changes. And what we now talk about that is neuroplasticity. There's a researcher, Doblin, who is from Johns Hopkins, who is now at UC Berkeley, and she's done work in critical periods. So we know that kids can learn language better than adults. You know, that if you grow up in a multilingual home, you kind of pick up different languages more easily. There's critical periods for eyesight, for all sorts of different neural functions. And she's done a series of studies in different animal species and demonstrated that psychedelics open up these critical periods. And the longer you're in the psychedelic state, the longer you're in this critical period. And what that means is you have more opportunity during this integration process to rewire your brain, to take insights that you'd gotten, experiences that you've gotten during a psychedelic state, and then integrate them into your daily practice, into your daily patterns of thinking while these critical periods are open. And so that's what we talk about in terms of neuroplasticity, critical periods. And so, where, back when FDA said we could only work with healthy normals, and then Charlie went off to do work with psilocybin with end of life, that started the whole work with psilocybin with cancer patients. But then I felt like, okay, now let's get back, because we challenged a lot this neurotoxicity hypothesis, and I felt like it wasn't as strong anymore. So that's where we moved in 1999 and 2000 to do the first MDMA PTSD study. That was before 9/11. That was before Iraq and Afghanistan. So it turned out, though, that the amount of trauma that people realize our veterans have gone through is just incredible. So it turns out that MDMA for PTSD was exactly the right choice for which psychedelic and which patient population would make it through the system. And I like to say that MAPS doesn't do science, we do political science, which means that we have political overlay to the science that we do, because we're looking for political implications of the scientific research in reducing support for the drug war, making psychedelics more legally available, and being able to go through the FDA system. So I'd say the education I got at the Kennedy School in public policy, and it was my shift from learning to treat individuals to learning to treat a culture. So I think what MAPS is doing is psychotherapy for sick public policy. And that's why the science that is the mechanism by which, but it's very carefully chosen science. So that's where I say it's political science.